Hello, everybody. My name is Betsy Johnson. I'm on the implementation team at TAC. If I haven't met you yet, nice to have you with us. I'm joined by two of my team colleagues, so I'm going to ask them to introduce themselves. And then if it's okay, we'll just kind of really quickly kind of go through just so everyone could just quickly state your name and kind of what your connection is to AOT and where you're from. That way we can, it's nice to know who we're talking to. And then we've got a couple of folks we've asked to just share their stories. I've got two champions who have had quite a bit of success in their communities, and so I wanted to ask them to talk a little bit about that. And then we'll go ahead and just open it up for general chit chat. So, Amy.
Hi, everyone. My name is Amy Lukes, and I am so pleased to see so many new faces, a good number of familiar faces. Happy to see those as well. But I am the director of the implementation team, and I am a social worker by training with experience in community mental health. Brooke.
Hey everybody, my name is Brooke Gentry and I am the AOT implementation coordinator on the team. And my main role is managing our resources. So great to see you all and great to be here today.
Thanks, Brooke. So I'm just going to kind of start to the top of my screen. So Cassie Tavares.
Hi, I'm Cassie Tavares. From the Owensboro area, River Valley Behavioral Health in Kentucky. And for AOT, I'm the forensic liaison. Welcome,
Cassie. I was so excited I pronounced your name right, because we have a senator who's Tavares, but apparently that's a little different. Yeah. But she's well loved in the mental health world. I don't know if you're connected to anybody in Columbus, Ohio, but you have a namesake here. Leslie.
Good afternoon, everybody. I'm Leslie Carpenter. I'm a family member at AOT Champion in Iowa City, Iowa.
Thank you, Leslie. Anne.
Hi, my name's Ann Cochran. I'm from Massachusetts. We're one of 3 states that does not have AOT, but we're working really hard to get it to our state, and things just seem to rolling along. So fingers crossed.
Nope. You're in the right group. Michelle.
Hi, everyone. I'm with Geauga County Board of Mental Health and Recovery Services in Ohio. I'm working closely with Betsy to roll out an AOT program. So we have not quite rolled it out to the community. We're in the process of writing the program, and happy to be here and learn from all of you champions. Thank you for having me.
Thanks for being here. Elizabeth and Anna, I'm going to hold off on you. I'm going to introduce you in a little bit when I ask you to share. So I'm going to go to Kate.
I'm Kate Gerskis from Southern California, and I have mental health issues in my family. My nephew suffers with schizophrenia. He is currently in prison, and my son is a homeless fentanyl addict.
Oh. Thanks for being here, Kate. Wendy?
Hi, my name is Wendy, and I work at NAMI Utah in Utah. But the reason I'm doing this work is because I do have an adult son who has serious mental illnesses, and he's experienced the gamut. He's court ordered to treatment right now, but it's about to expire. And I'm just a champion for the outpatient court ordered treatment, because that's the only thing that's really seemed to help my son, and I want to keep it going.
Awesome. Well, we're so glad you're here, and we look forward to working with you to make that happen. Itzel, good to see you.
Hi, I'm Itzel Moya from Kansas. I am the NAMI Kansas AOT Project Director.
And Margaret?
Hi, my name's Margaret Elmer. I live in Littleton, Colorado, and I'm interested in promoting AOT in Colorado.
Glad you're here. Brianna?
Hi, I'm Brianna Samora. I'm an associate justice with the New Mexico Supreme Court, and I'm the liaison to our Mental Health Commission. And one of my goals is to expand, which it's virtually non-existent, the use of AOT in our judicial system. So I'm trying to see what other states have done so that we can make sure that we start getting our judges here in New Mexico to do the same.
Welcome. Thank you for coming. Ruth.
Good afternoon, Ruth Samara. I'm with the Coordinating Centers of Excellence at Northeast Ohio Medical University, and our centers collaboratively work across the state to try to ensure that people with serious mental illness have access to good health care and system supports no matter where they live, stay, or study. And AOT is part of that puzzle. Thanks to TAC, we have a reasonably robust AOT program in Ohio and growing, and we try to support that in the work that we're doing.
Thank you, Ruth. Megan.
Hello, my name is Megan Hebert. I am from Michigan, Oakland County, near the Detroit area, well, outside of that. But I work for Oakland Community Health Network, and I am in a new role. We just created the Assisted Outpatient Treatment Coordinator role. So we're really just, trying to, get the ball rolling here in Oakland County, just trying to, make things happen here. So I'm going to be in and out with my camera because I do have to pick up my kiddo early. So I may just be listening because daycare closes early today. So sorry.
Thanks, Megan. Nikki.
I am from Oxford, Mississippi, and work at a local community mental health center. And I'm currently the AOT project director here.
Oh.
And Jessica.
Hi, I'm Jessica Mays. I am the AOT program coordinator for the Kansas Department for Aging and Disability Services.
Okay. I don't know if Jennifer's here. I saw a be right back note from her, so we'll come back. Jennifer, are you there? No. Okay. Josh. Welcome, Josh.
Hey, I'm Josh Spicer. I'm with New Vista, Kentucky, and we are getting the project started in Lexington. So I'm just here to learn and see how everything works.
Good to see you. Alan.
Hi, everybody. I'm Alan Marshke. I'm a judicial liaison for the Department of Human Services here in Colorado. Happy to be here.
Thanks for joining. And Joanne.
Hi, everybody. I'm on staff with TAC, and I'm just always looking to learn as much as I can to people who know the most. So thank you.
Thanks, Joanne. Well, welcome, everybody. We've got a great group. As I mentioned, we just wanted to kind of kick off our conversation by hearing from a couple of folks who are doing great work in their state. The first person I want to introduce you to is Elizabeth Pratt, and Elizabeth is with NAMI Lansing. And recently they hosted a forum up in their community around assisted outpatient treatment. And then I think that was followed up the next day with a luncheon. So I was just going to ask her to tell us a little bit about that and then just open it up if anybody has any questions. So we're interested, Elizabeth, in just, whatever you're willing to share. So thanks.
Thank you, Betsy. I'm from the Lansing, Michigan area. Volunteer and family member. I'm with NAMI Lansing. For Mental Illness Awareness Week, we had the two special events. The first, before the mental health crisis, assisted outpatient treatment was a public event that was to inform family members and professionals and also policymakers about the availability and success of AOT locally, and then discuss some specific advocacy needs. And the second event, the following day, was a leadership lunch, moving toward effective outpatient treatment, where we brought together community leaders from a variety of areas, including our community mental health, psychiatry, law enforcement, courts, legislative and congressional, social work, and advocates to identify more specifically the local needs for collaboration to make AOT work better, and to develop an interdisciplinary AOT steering committee. As we were developing the program, we really appreciated being able to meet with Betsy, Amy, and Brooke. And we did have a really outstanding panel. We had a moderator from the Wayne State University Center for Behavioral Health and Justice. We had Judge Milton Mack, who's an AOT advocate we're fortunate to have right here in Michigan. Christy Granger, the court coordinator at our Community Mental Health Authority, and also Jeremy Hall, who's a certified peer support specialist who has lived experience with involuntary treatment in his background. So the panelists did a PowerPoint with dialogue, and so they were all able to comment on the various issues that came up and then questions from the audience. At the public event, we had over 70 people came, including about 20 people who were there for continuing education, which we had available for physicians, nurses, and social workers. So one of the main things that came out is that we all learned a lot about the benefits of AOT and the success that they're already having locally implementing AOT combined orders for people coming out of the hospital, which they're able to do for both people on Medicaid and with private insurance and private providers, where our local community mental health has a team that will support private providers as they're serving people on treatment orders. At the leadership lunch, it was really exciting. We had nearly 50 of our invitees came. They heard an abbreviated version of the presentation from the public event. Then they were assigned to small groups where they were mixed up so the different disciplines could talk to each other, and each group had different questions to respond to, and then they reported back to the larger group. And we, out of that, came up with, I think, new connections among people, and a lot of need for training was identified from those things. And then some very specific problems that people had, and in like connecting with the next layer. So a lot of very interesting things came out of that discussion. We did achieve partial membership in our proposed assisted outpatient treatment steering committee locally. We got a request from a local prosecutor to repeat the public program to the extent we can up in his county. And the challenge for us now is how to follow up effectively. And, we're all volunteers that were at NAMI Lansing. And so like pulling that all together and maintaining that momentum is something we really want to be able to do. And we found out we have some really great community partners. So thank you.
That's awesome, Elizabeth. I think it's really important that for folks, particularly new programs, when you're trying to attract people to come to your events, offering CEUs really does help, at least initially, to get people to at least, come and learn more about it. And then, so that was smart to do that. How did you get, those are great turnouts at both events. How did you manage to do that?
Well, the public event, we had an ad in a local newspaper. We did a paid television spot on a local news broadcast. We did Facebook advertising, which was, I don't think, very successful. And then our own mailing lists. We did both the U.S. mail postcard to our frequent contacts and then our constant contact list. For the leadership lunch, we did emails. I visited the county commissions in person and spoke at public comments. And my colleague Margaret is a nurse practitioner, a psychiatric nurse practitioner, and she worked hard to get some people there from our local hospitals, from Blue Cross Blue Shield of Michigan, and used contacts, people that she knew professionally and personally, to make sure that psychiatry in particular and the insurance and the hospitals were represented.
That's amazing. Questions for Elizabeth? You mentioned the public comments at the county, I think it was their county commissioners public forum. That's something that I'm not sure a lot of folks are aware that that's a lot of public entities that usually at the end of their board meetings have sort of a, on their agenda, just an opportunity for anybody in the public just to step forward. And that's a great opportunity to avail yourself of. Maybe got sort of a, you've got their audience and they're, they have to listen to you, don't take advantage of it and go too long. Otherwise they get angry because they're tired from the meeting, but it's a great opportunity to educate local leaders about AOT.
I have a question. So were you saying that this was a meeting to expand AOT in your area or to initiate and start AOT in your area?
Well, we already have in Michigan, we already have a pretty good law for AOT combined orders where they get AOT after hospitalization. And then we wanted to help expand the access to AOT only, which is allowed under Michigan law, but it has a couple of pretty specific barriers to it, the way it's set up. So that's both trying to find workarounds and then working on some law changes. So we were trying to expand, the goal really is to expand the access to AOT only. But yeah. And I'll also just mention that Judge Mack has, working through another statewide organization, the Mental Health Association in Michigan, is working on bills to make assisted outpatient treatment a diversion option for misdemeanor offenses related to mental illness, where there's agreement from the defense attorney, the judge, the prosecutor, and others, that that's an acceptable option so that people don't end up with a conviction like they need to get into mental health court. So that we also wanted a chance to talk about that, especially with law enforcement, the prosecutors, and the judges.
Yeah, that's certainly getting a lot of attention right now with communities looking at AOT as one alternative to competency restoration. I know in Ohio, we had a law change. I mean, right, in my understanding, I'm not an attorney, but it's already permissive. I mean, if you've got a prosecutor who's willing to dismiss and file, a petition in civil court, they can do that. But having the law be more clear in terms of providing some structure and outlining sort of how communication works between the criminal court and the civil court. Because a lot of prosecutors are uncomfortable just dismissing those charges, even knowing that they could refile them at a later date if they don't know if the person's successful in the program or not. So ensuring that they know if that person is not doing well or they've been dismissed because they didn't follow through with treatment is really important to get prosecutor buy-in. So I think state laws that kind of spell that out certainly help raise awareness about this as one possible option. It certainly makes a lot of sense. So, and I think we're going to have a lot more communities coming to AOT just for that reason, because communities are really struggling with, folks sitting in jails waiting, their chance to be restored and knowing that they're unlikely to get restored. And then those cases will be dismissed. Now there's a way to monitor them in the community under AOT. Are other folks having conversations in your communities or your states around AOT as an alternative to competency restoration? Okay. Well, so next, I was going to ask Anna from NAMI Washington to talk a little bit about NAMI's role as Washington. The state of Washington has recently modified its state law and is rolling out AOT across the state. And NAMI's been very involved in both the legislation and now with the rollout. So Anna, I was hoping you could share a little bit about what that looks like and what your role is and any lessons learned that maybe we could we could benefit from?
Sure. So my name is Anna Nepomuceno. I am the Public Policy Director for NAMI Washington. And so AOT has been technically on our law books since 2017, but wasn't being utilized very much in our state. And so in 2022, an AOT bill was passed that streamlined the AOT process. It broadened the range of people who can petition for AOT, and it provided more funding, which was a huge barrier, that there wasn't enough funding invested in AOT. And so that passed in 2022, and NAMI actually had that bill as one of our top priorities for advocacy. And so we had a big grassroots campaign to advocate for this AOT bill, and fortunately it passed. A year later, the regional behavioral health organizations came to the legislature and said there are some changes that we feel need to be made in order to implement AOT better in our state. So in 2023, there was another bill that was introduced. Unfortunately, it didn't pass because there was an element there. For some reason, the behavioral health organizations were asking to lower the burden of proof, and that was very controversial. And so because of that particular issue, the bill didn't pass. But having that bill on our priority list again, and giving me the chance to advocate for it to legislators, gave me the opportunity, or gave NAMI Washington the opportunity to further educate legislators on what AOT is. Because even though there was a bill in 2022, and even though AOT has been in our books since 2017, the vast majority of our legislators really had no idea what AOT was. And so in 2023, I met with various legislators, educating them on what AOT is, and convincing them to see the advantages of having a robust AOT system in our state. And so for any of you that may have seen on the news, Washington State was sued. It was called the True Blood case. And so it's because our state has an issue with people sitting in jail for long periods of time. I mean, the wait time was almost up to a year for people that get arrested and sitting in jail waiting for their competency restoration. And so there was another bill introduced last year to address the True Blood clients and to mitigate the wait time. And so what happened is that AOT bill didn't pass, but AOT was written into the legislation addressing True Blood, and it was written in as a form of diversion. And so we had just recently talked about, in this group, states looking to AOT as a form of diversion. And so having this bill and writing AOT in there really gave us an opportunity to push AOT and to, let legislators know this is a viable option. It keeps people out of the criminal justice system. It takes people out of that vicious cycle of homelessness and jail and hospitalization. And so AOT actually got written into that particular piece of legislation, which has been a tremendous help in really kickstarting AOT implementation in our state. So once that bill passed, and after the legislature ended their session, all of the regional behavioral health organizations were instructed to start planning their AOT rollout. And so all of the different regional organizations are now obligated to check in with our state's healthcare authority on a regular basis to give them progress reports on where they are with AOT. And then the state has also put together an AOT stakeholder group, and NAMI was invited to be a part of that stakeholder group. And so we are also constantly updated on what the different regions are doing on implementing AOT, what the barriers are. There's more further education for some of the stakeholders that don't have as much knowledge on AOT. For me, I had the advantage of going to the AOT symposium in Texas a couple years ago, and that was just a huge game changer as far as really elevating my knowledge of AOT and allowing me to come back to our state and taking that knowledge to really push AOT and advocate for it within our state legislature. And so we are continuing to have these stakeholder meetings. And one of the things that I'm actually doing as an extra is I'm actually reaching out myself to the regional behavioral health organizations and getting their input as far as, what are their barriers, what is preventing them right now from having a smooth rollout of AOT. And I'm actually working with Senator Dingra. We had a robust meeting regarding AOT, and she's kind of tasked me with keeping her up to date about what I hear on AOT. And one of the things we're looking at is there going to be more legislation needed for this year to make sure that AOT rolls out across the state, or do we need to ask for more funding? And that more likely will be the case, because funding is always an issue, and that is something that I'm hearing recurring. There's a need for more resources for our courts, and also just developing the treatment system, because right now, our state has a lot of work to do, and that's one of the arguments that some of the pushback was using, is that we don't have a good behavioral health system set up in our state. So how are we sending people to treatment when we don't have treatment? And so this is something that we're trying to address as well, to make sure that when people are assigned assisted outpatient treatment, that they will get the quality treatment they need towards recovery. And so it's really super exciting to be a whole part of this process of implementation and keeping track of all of the different local organizations that are the local regional organizations that are doing it. We actually had a meeting last week with my own county's AOT implementation team, and also the prosecuting attorney from our county, and and learning about some of the barriers that they're experiencing. And so let's see. Sorry, I'm kind of lost track of my notes. Anyways, so that is oh, and then another thing that we're working on is, so NAMI Washington really feels it's very important to educate people on AOT, because again, legislators didn't know about it, and regular everyday people don't know anything about it. So something that we're actually working on is coming up with our own informational brochure that we can hand out to our members and the general public, educating them on what AOT is, because we're really passionate about AOT and believe that AOT is a wonderful option to keep people out of the criminal justice system and to address our issues with the long wait times for competency. And so that is what we're doing in our state.
Anna, thank you so much. That was awesome. Congratulations on all your hard work. I'm curious, could you just mention, you mentioned funding. Could you mention how much and what it was set aside for?
I do not have that information on me, but I can definitely get that information to you. I'll have to look at the fiscal note on that bill.
Sure, great, thank you. Questions for Anna?
I have a question, and also maybe for anybody else too. I'm wondering, I know it's complicated. And like in Utah, we do have some court-ordered outpatient treatment, but it's not utilized as it could be, and it's definitely not used as a jail diversion, which would be awesome. And I also know that a lot of people become homeless and get evicted from their apartments and cannot obtain housing because of untreated mental illness. I just wonder if anyone's ever explored that as another gateway to AOT. I don't know, as far as like an eviction isn't going into the criminal justice system and you're not getting hospitalized. But what if landlords or somebody could call and say, hey, this person's going to lose their housing if they don't get AOT? I don't know, the civil commitment process. I don't know, just that idea came to me.
From my understanding, for at least for Pierce County, and this, I'm only saying this because I have it fresh in my mind, the person would already have to be in some form of care, whether they're headed to ITA or they're already in ITA, or so I don't really know. We don't really have a system where when people get evicted, there probably would be concerns about the landlord referring them, because the landlord could be biased against that particular person. But we have expanded the the number of people that are qualified to refer people to AOT.
Yeah, we have some VOA outreach workers who outreach to homeless people and can make referrals. And I just thought we should have them we can call, like, that's what happened with my son. He's about to be evicted, and a VOA worker actually came and made the referral with the leasing manager because he didn't want to evict him, but he couldn't manage. And so anyway, but just wondering.
I could see sharing this with the public housing authorities around the nation so that they have some sort of leverage and help and collaboration. I know that in the past I've supervised case management programs in our county, and our public housing authority would come to us and ask for help because they did not want to evict people that were just struggling to maintain their housing. Because if you lose your public housing, you're really losing, it all, because it's really hard to recover after that. And so I could absolutely see, and this is giving me ideas for my program as we roll this out, to really bring them in as a stakeholder in order to help people maintain, that subsidy.
Yeah, they absolutely make an excellent referral source because, and I often, as a family member, I think we should look at families who are struggling with loved ones in their home and kind of at wit's end and ready to just say, I can't do this anymore. And, catch them before they say, okay, you're going to have to find somewhere else to live. Let's get them the help that they need before that happens so they don't become homeless. And that's where I think that relationship, why it's so important to keep NAMI at the table locally when you're talking about these programs, because NAMI knows who those families are that are in trouble and can help make referrals, and so you can get them the help they need before they're out on their own.
I think that one of the issues when I hear about this is and this is as a former case manager, is how can you convince someone that it's required, and depending on the state, that can be a nurse practitioner, can be a psychiatrist, that this is an emergency situation. And, when I was doing homeless outreach, there were situations that clearly met that emergency situation. For example, I had one man who was taking out the electrical in his apartment because of he felt that he was being monitored. So that was pretty much a slam dunk to get that person, because that's dangerous. But some states also have meeting basic needs as part of their statute. And if that's the case, then an argument can be made that someone who's homeless because of their mental illness is not meeting their basic needs. But it can be difficult to use homelessness And I've actually had a psychiatrist say to me that, you know, just being homeless isn't an emergency. And I even had one psychiatrist set an arbitrary number that 13 degrees was you know, it had to reach 13 degrees before he'd pink slip any person with severe mental illness out on the street.
Can I jump in and answer one of the barriers that Anna brought up? Is that okay?
Absolutely.
Okay. So Anna, you mentioned that some of the barrier is that the behavioral health providers, the mental health providers are already overwhelmed and, you know, it's hard for them to meet the need already. I would counter that by letting them know that if they're working in coordination with a judge and a case manager to provide this care and they're keeping the person in treatment, it is actually going to reduce the stress on the overall system. It helps them to be much more efficient in the care of people. And I think it's important to make that argument because they're already dealing with these people. This allows them to more effectively deal with them and keep them healthier, which puts a lot less stress on everybody.
Is that why you went outside?
Sorry about that. Go ahead, Leslie.
Thank you, Leslie. Oh, keep going. Yes.
I don't know if you were. I'm not sure if you were finished. Okay, sorry.
Thank you, Leslie. I definitely keep that in mind and use that as pushback against that argument. Thank you.
Are there other things folks wanted to discuss with this illustrious group? Anything is fair game.
I was just going to share with Anna, since they're starting on their trifold brochure, Kansas has already created one, and you are welcome to steal language or the whole thing and stick your logo on it. I sent it to TAC, so they should have it. I don't know if it's out on the website or they can send it to you.
That would be wonderful. Thank you.
Absolutely.
We work smarter, not harder. And if I can help you save a little bit of time, then I'm all for it.
Thank you.
I'll send that to you, Anna. And good chance to do a plug for our resource library. Sorry to interrupt everybody. TAC has a robust resource library, and we've got all sorts of things on AOT, whether it be examples of forms from other areas or actual templates where you can plug in your own info. And I will put the link to the resource library in the chat. We are overhauling our website. So the good news about that is the new resource library will be literally bigger and better and easier to navigate. But in the meantime, you could still access documents through our existing resource library.
And I just have to say, this is what I love about this community is that so many people are willing to just say, steal our work. You know, we've done the hard work. Just take it, make it yours, and don't reinvent the wheel. So way to go, AOT community. Rachel.
And if you, yeah.
Oh, sorry.
Yeah, so I'm Rachel and I parent a son with who lives with schizophrenia as well as diabetes. And he was put into a ward, a special hospital, the best one, public one in San Diego. And his blood sugars were running at 300, and he was having serious problems with that as well as delusions, and they refused to call in an endocrinologist or any physician, saying that this is the psych ward and we don't do both. So after it all ended about 3 months ago, 2.5, 3 months ago, I was calling different NAMI numbers, and one woman said, don't they know about parity? It's a law. And so I just wanted to bring that up. I didn't really find that much out about it. But I mean, in terms of the law, I looked at the law, but they basically got rid of him because he was fighting with them for insulin. I'll try to keep it short. And they had snacks at the end of the hall, and they said that he had an eating disorder. And my husband said, is there any way you could put the snacks at the end of the hall? Because he eats when he gets nervous, and he was obviously locked up against his will. It was a hold. And they said, no, that's against the law. And they wouldn't call anyone in. And I called the ombudsman. I've never done that before. He's been hospitalized there only one other time, and that didn't happen. And they said to me, it's a policy. We might change the policy. And they've never called me back. I just wanted to share that story. And if anybody could give me any input or help on that or suggestion, that's it.
That's a horrible thing that happens. And unfortunately, it's all too common that medical concerns are ignored by psychiatrists, especially in inpatient care. And what we have found, just as another suggestion to try, in addition to an ombudsman, is to go to the secretary of the CEO of the hospital, make friends with that person. They move all kinds of things that you can't get done in other ways. And you often could get a lot of action done by doing that. It makes you a high maintenance parent, but honestly, who cares? It keeps our kids alive.
Okay, thank you.
That's awesome, Leslie. That's a new one for me. I'll have to remember that. Just one more thing on the brochures. If you do put something together that you're especially proud of, we'd love it if you would share it with us. Eventually, when we get this new webpage up, we'll have a state page where you can just go and download all the things from your particular state. So the more information we have, the more helpful it will be to each of you. I mean, you can still, find it in the large directory, but if you want to just see what's available in your state, that'll be a new option too. So we're trying to build that library.
I have another question. Is it Insel, a participant here who I heard is an AOT director at NAMI, Kansas. Can you tell me more about your job description and duties and what that entails?
Yeah, so in Kansas we have 5 pilot sites that are working under a main SAMHSA grant, and within that we included in NAMI, Kansas. And really what we're doing with our pilot sites is we're there to offer, we're there to help with advocacy, we're there to help with resources and support. So in each of our 5 pilot sites, we also have what we call AOT, NAMI Kansas AOT specialists. And these NAMI specialists in these areas are just people that are well versed in NAMI resources in the state. And we make sure that the NAMI affiliates in the area are well and going. They know about AOT, they know about the resources in their community. We try our best to keep NAMI support groups and educational groups going. And if there's nothing in person in the area, then we try our best to have connections throughout our other affiliates in the state so we can offer virtual groups for any AOT participant. So really what NAMI Kansas is doing is that we're there to offer that support and that education that some of these areas might need, and that includes the mental health team, their stakeholders, parents, AOT participants, really anyone that needs more mental health support and education. We're there to help. We are there to help them with that.
And so correct me if I'm wrong, but do these individuals actually attend the hearings? And is that correct?
Yes. So we have, and again, it's up to, I let that be up to the jurisdiction of the AOT specialists in their area. If they're not comfortable being at a court docket session, that's okay with me. But yeah, if, for example, in some of our counties, we do have that AOT specialist that's there during the AOT court docket date, and they're there with NAMI resources, and they're there with knowledge of other resources in the area, and they're able to speak with the AOT participants. You know, they ask them if they are interested in any NAMI resources that are available in their area. They ask them if they'd be interested in their consumer-run organizations, CROs, if they'd be interested in going to that or any other community organization that they have in that area. So yeah, we do have a NAMI representative in our areas that are there for the court docket. They're there to help. And what we've noticed too, it's nice to have another peer there. So it sometimes the round table of AOT, it's a lot more comfortable for the participant to be able to discuss what their concerns might be, but knowing that there's also another peer that's on their side, which is usually that NAMI person. We've noticed it also helps them as well. They feel more comfortable with that.
And I'll say that NAMI has been a huge part of Kansas's success with our sites. And what we're realizing is that the peer support and that peer, it's key to the success of your programs. In fact, most of our programs are adding extra peer specialists on. Azel's group, they're there, but they're very, very, very part-time and half volunteer, I think. So the centers are actually bringing in full-time peers on staff to help with AOT, but it's a big component to the success of the program. And I really couldn't do it without Azel, to be honest. She's fantastic.
Thank you. Yeah, I've throughout our process and our Kansas AOT journey, I've really been an advocate for peer specialists and peer workers, and any peer that we could get to help, if it's a NAMI volunteer or a peer support specialist or someone in the CRO, we want them to be present in the conversation, because that's truly what helps. They're the experts in their own field, and they're the ones that could help us the most when it comes to these AOT participants.
Right. And then when you say attending court, do you mean the regular court docket, or is this a commitment court or a mental health court?
Yes, it'd be the AOT in Kansas. We have monthly AOT court dockets in the pilot sites that we currently have. So our NAMI staff is there for that.
Okay, thank you.
And I see your question in the chat. So I mean, for example, here in Kansas, we have most of the community mental health centers, or CCBHCs now. I just never know what that stands for. Most of these have a peer support specialist or multiple peer support specialists on staff. And for example, what we see in the pilot sites here in Kansas is that these peer support specialists, they are there to help them with life skills, such as going to the grocery store, learning how to do laundry, learning how to do those life tasks that sometimes they might struggle with, but they also help with self-care. They help with anxiety. They are working with them if they have an SUD, then they are also working with them with SUD. So what I've noticed here in Kansas is that peer support specialists are key players really in our treatment teams.
Yeah, I think peers are especially good at engaging people who are not interested in receiving mental health treatment. They'll much more easily engage with someone who is not necessarily seen as a professional, even though they do have training and are certified. We strongly recommend that peer support be a part of the continuum of care offered to actually anybody with severe mental illness.
I'll share another example that helped with our program. We had a peer support specialist go with a patient to the doctor's appointment, and the peer support specialist was able to pick up on how the doctor and the patient interaction was not good. The patient completely changed in their whole personality. And from that, they were able to identify that perhaps a different provider would be better, and they helped to make that change. That probably wouldn't have happened or even been figured out if the peer support specialist hadn't been there to observe all of that. It was great help for getting the person some advocacy for them.
So I'm going to go ahead.
I have a quick question. In Massachusetts, NAMI Mass and the peers have been the huge opposition in getting AOT legislation passed. So my question is how, if anybody has ideas, how do we get through to these peers to get them on board to then see that, you know, this is a good thing that's going to prevent criminalization, homelessness, you know, all these other things. I don't know if anybody has any input on that.
Is it the civil rights issue? I'm just kind
Yes.
of curious what their argument is.
Yes.
Well, we've been working through here in Kansas because we did legislation last session and hit opposition. But what we're trying to remind these folks is the point is to keep them in the community. That AOT is to keep them out of the hospitals, out of the jails, and in the community where they belong. And I think it's almost always a turn of phrase. So like the woman that I'm working with, we're actually in negotiations to come up with language so that we can all go out together and I don't have to worry about opposition when we go to the legislature this session. She keeps saying things like, well, you know, danger to self or others. We don't want that classified as somebody's running around just slapping people. And I said, well, if you slap someone, it's assault. So they're going to end up in jail anyways. She keeps coming up with these crazy, simple ideas of, you know, different ways that the law could be abused. And finally, after months of, well, you know, that's still assault. They're going to end up in jail. You know, their civil rights are still in place. Their due process is still in place. The judge is not going to just throw people willy-nilly into the hospital or into programs. She finally got it. And now they're proposing fantastic legislation that was way above anything that I had suggested. But I think it's all turn of phrase. They have to get it around their mind that this is to keep people in the community and to not want to lock them up. Because I think that's what they've seen in the past is people wanting to lock them up. The goal is to keep them out and get them healthy and onto productive lives.
Yeah, I mean, I think that's what we're trying to do and educate other peers. And I think one of the big barriers has been that NAMI Massachusetts as a whole has been against it. So the information they're putting out, as well as another large mental health organization, Mass Mental Health, they're just putting out information, scaring people. So of course they're going to think, you know, say, no, we don't want that. And so that's been a big barrier for us. And even reaching out and we've been trying to reach out and educate the different NAMI affiliates, and they won't even talk to us.
Gazelle, are you willing to do some meetings?
Yeah, I was about to suggest that. So if you know, yeah, I'm more than willing, and I know our Sherry Vaughn, our executive director, would also be more than willing to have some meetings with the NAMI Massachusetts, and you know, we're all for AOT here in Kansas. And personally, I've sat in these AOT court dockets, and I know the amazing relationships the treatment team and the judges form with the participants. So I'm more than willing to talk with anyone really. If any, you know, any NAMI has any opposition, we've seen here in Kansas that relationship is awesome. And hopefully that would, you know, that might help a little bit.
Yeah, I mean, I think that would be great. The problem is if we reach out to them and try to make that connection, we'll get no response, none at all. I mean, they just don't even answer. So there's an organization called the AOT Now. It was a couple that hired a lobbyist on their own. I've kind of, you know, joined forces with them, and, you know, we're really moving forward with this legislation, but we just cannot seem to get through to NAMI Mass
at all. And if you actually read their statement in opposition, it's horrifying in that they're quoting information from Mad in America. And that's what our NAMI Mass is doing. I mean, they're hosting events by Mad in America, which I just find appalling. So it's trying to break those barriers. And we do have some affiliates, like specific affiliates that are on board with us, but they've gotten in trouble for speaking out. So now they've joined us as an individual, not representing their NAMI. And then they, of course, can't share any of the information on AOT because they're not allowed to at the state level. So it's just, that's been like probably our #1 barrier.
I wonder if NAMI National would be willing to hold a, virtual forum on this and maybe invite, a panel of different, from different states, so you could have this conversation in a more public forum where you where they have an opportunity to state their opposition and somebody else from NAMI can refute it.
I think in the past, what's happened is they said we leave it up to each state affiliate to decide what they want to do. And I actually had a conversation with Dr. Ken Duckworth at a NAMI event that was in Massachusetts talking about AOT. And he kind of just shook his head. He said, I am a huge believer in AOT, especially after interviewing Eric Smith. And it was just, he said, you need to keep fighting. So I think so much of it is politically what's going on, and all the turmoil within the organization itself, at the state level.
Okay. I see we got a couple of hands up. I apologize. I don't know who was first, so I'm going to call on Megan first and then Cassie.
So if I can add, so this is the tricky part, because we have a process within Oakland County, Michigan. We do not have a program. We obviously would like a program. We have to get buy-in from judges, funding, there's lots of things, but there's one point that I just wanted to add, is that we have seen hospitals, to be honest, overuse AOT and use it when treatment providers have said this person doesn't need to be on an AOT order, and they're still putting them on an AOT order. So I don't know if one of their concerns is, yeah, it's great, we have great, we have rules in place for AOT within Michigan, but not having that program is really a huge barrier. Like and I come from, so I just came from a different position. I was in specialty courts. I was a mental health court liaison for 6 years. And I know some people have mixed feelings about mental health courts, and I'm biased, obviously, but I've seen firsthand how the black robe effect works, how having a team of people to support individuals is beneficial, and not having that, I do think there is the risk of AOT being overused when people aren't educated. So I don't know if maybe coming at it from like a worst case, like if you bring in some of that, maybe acknowledging some of their concerns might help, because I know we have seen that, and that's a concern that's still brought up, is we have people on both sides who are like, they're for AOT, but say we still have some concerns because if you're not getting proper education, it can be misused. If you don't have all the players on the team. So I don't know if maybe that's where some of their resistance is coming from, because that's just food for thought. So thanks.
Megan, yeah, we'd love to have a conversation with you about some ways to address that issue. So I think we've got some suggestions for you might want to consider. So that is problematic. Anybody want to respond to Megan? Cassie, did you have a question?
I had a comment to insert somewhere around there about the slapping being assault. I was wondering if that specific state has well-defined, I guess, guidelines for the involuntary hospitalization of the mentally ill. That's what we use to define what differentiates between like an ordinary slapping and a mental illness. Is that, I don't know if that makes sense.
Yes,
like,
we have very defined,
yeah.
Our legislature really went to toe when they defined danger to self or others.
Yes.
It's several paragraphs. It's well defined. The problem is that sometimes your opposition doesn't read statute. And so when they run around and are, throwing things out, it doesn't apply to the law. It doesn't fit. And so you have to know what you're talking about. More than once, I've had to explain the definitions page in our statutes and how to go back and read it and what this means and how it references back. And these are opposition for legislation. So but yes, we are very well defined. It's just a matter of whether they read it or whether they take an idea and run with it and don't pay attention to what's in the law.
I want to respond back to Anne and also Leslie. I think Leslie's comment is right, is finding someone who doesn't wear the AOT Now label. And I think it's really important for folks to hear from those who've been from the program. We had a call earlier, and we were talking about this, that, those that are so opposed, especially in the peer community, tend to be those who never needed involuntary treatment and don't understand anosognosia and the consequences of not being in treatment, and actually hearing from someone like, as you mentioned, Eric Smith and Bradley. And I want you to know that one of our Royal Hour, it's actually Brooks' goals is this year is to develop a speakers bureau of AOT graduates, so that when we have these situations, that we have someone that is willing to testify or give a talk or whatever you need to break down those barriers, either on the state or local level. So we are working on that.
Yeah, and we did have Bradley Tarr testify this legislative session. Eric Smith did the last session. So, we are having people that have been through the program. And the thing, I had to leave because I was jumping on a plane to Italy, so I never even got to testify. I had to send in written testimony. But it was my understanding that Ashok and Vanita, who were the founders of the AOT Now group, went up and introduced themselves to a few peers after and asked them why they were against it. And they were totally misinformed. And they were just kind of looking at Ashok and Anita like, well, I had no idea that's how it works. So it's a false information that's putting out by groups like NAMI Massachusetts and Mass Mental Health. And I think that's where the problem lies, because these are trusted, they're supposed to be trusted resources to help people. And the information they're putting out is, totally inaccurate. So I think it's just, continuing to educate people. I belong to a couple of groups in Massachusetts, Mass Behavioral Health Partnership being one. And, I'm always bringing it up, to try and educate people.
And, we have our National AOT Symposium scheduled for November of 2024. So be on the lookout for more information about that soon. But that might be an opportunity and to get some folks there that, folks that are reasonable, that are, want to become educated on this issue or are willing to, to get them there, and we can put them in touch, face to face with some of these folks. And I think we can convince them.
Well, I actually just recently had the ex-girlfriend of, I don't know if anybody's familiar with this, this is from Massachusetts, Christopher Ferguson, who was a man that was psychotic and killed 3 innocent people. So we had been in contact with the girlfriend, and when you hear her story, it is just heartbreaking to hear what they went through trying to get this guy help. And he was hospitalized 3 times. Let go after 72 hours, was never stabilized, family begging for the hospital to keep him. and then this is what happens. And, you know, the story that's been put, she said, the story that's put out there is that he was a deranged Black man just violently going around killing people. She said that wasn't the case at all. We were all trying to get him help. And none of that is in the media. So I actually reached out to the Attorney General, and I think we're going to get a meeting, you know, a face-to-face meeting with her, because I think she can be instrumental in helping us push this legislation forward.
Yeah, finding a leader, a statewide leader that's personally touched by mental illness can be really helpful.
Yeah, and our Attorney General, she actually had 2 family members in the criminal justice system, and one of them died in jail. So I think that, you know, she's sensitive to the problems that, you know, we're having in Massachusetts. And again, I hope that, you know, even if she doesn't want to publicly say I support it, you know, give those legislators a call or send in a letter to them, because, you know, that's all private when it goes to them.
This has been a fantastic discussion. Anybody have any?
Elizabeth has her hand raised.
Oh, I apologize.
Thank you. One of the things that are most persuasive to me about the AOT was, you know, there's that research now that shows that the psychosis is kind of a progressive disease, and as you know, multiple episodes become, you know, damage the brain. And so, I mean, that just argues so strongly for intervening sooner. And the Judge Mack, when he talks about it, he uses the example that it helps people, you know, since hospitalizations now are so short, that people don't get to stay in treatment long enough to see the benefits. And AOT helps people to stay in treatment long enough to buy in. And examples of that is now, I guess, in some of the areas that have had a structured AOT program longer, like in Flint and other places that here in Michigan, they're having people ask to have their orders continued, because they know what happens when they don't have that structure and that support. So those are things that I found very persuasive.
And that's not unusual to have participants ask to continue. And as a matter of fact, it's a contested hearing is rather rare in our experience.
Anybody else? Well, this has been a fantastic conversation. I know Brooke is recording it, and she'll send out a copy of the recording, and we'll meet again in 4 months. But if there's ever anything you need between now and then, don't ever hesitate to reach out to us. Or if there is a document that you can't find on the resource library, we probably have it in our on our computer somewhere. So don't start from scratch. Let us know. We can get those to you. Amy, any final words for?
No, other than just as if you haven't been following the chat, the TAC implementation team is more than happy to meet with any and all of you. Just email us at AOT@treatmentadvocacycenter.org and we'll get something set up.
Thank you.
Thanks. Thank you.
Thanks all. Enjoy the
Have
rest
a great
of your day.
weekend.
Thank you.
Bye.